Welcome to a Families Thrive presentation. Families Thrive is a project of the Contra Costa County Zero Tolerance for Domestic Violence Initiative. We bring organizations in the community together to marshal resources, increase capacity, and build partnerships to address the specific needs of children, youth, and families impacted by domestic violence.
Good morning, everybody, and thank you for joining us. My name is Devorah Levine. I oversee the Contra Costa County Zero Tolerance for Domestic Violence Initiative, and we're so pleased that you've joined us today for a presentation by Dr. Edleson on assessing childhood exposure to domestic violence. Families Thrive is a very exciting resource that we are testing and piloting through Contra Costa County's Zero Tolerance for Domestic Violence Initiative. And our purpose is to engage professionals to work with each other in the community in learning about the issue of domestic and family violence more closely. We hope that you'll continue to look to Families Thrive for resources online, and we really look forward to your feedback about how this presentation is helpful and anything we can do to improve our efforts going forward. And with that, I'd like to introduce Dr. Jeff Edleson. Dr. Edleson is a professor and director of research at the University of Minnesota School of Social Work and director of the Minnesota Center Against Violence and Abuse. He is one of the world's leading authorities on children exposed to domestic violence and has published over 100 articles and 10 books on domestic violence, group work, and program evaluation. So please welcome Dr. Edleson.
Thank you, Devorah. What I'd like to talk about today is assessing children's exposure to domestic violence, and I want to start with assessment issues and then review available measures, some assessment procedures, talk about a new scale that we've developed here at the University of Minnesota called the Child Exposure to Domestic Violence Scale, and offer some supporting resources. So, child exposure. Exposure to domestic violence early on was called child witnessing to domestic violence, and you often hear it called witnessing. And I've tried to avoid that language because I think that it's really much more than the eyewitness that we think of witnessing violence. It's visual and audio. Most state laws that discuss child exposure to domestic violence say within sight or sound of the violence, and that's the visual and audio that you see on the slide right now. But as a colleague of mine, Susan Schechter, pointed out a number of years ago, that children are also used as a tool of the perpetrator in violent events, and they're often involved in violent events as well. I've seen children used as sort of informants about their mother, actually punished in front of their mother physically to punish the mother, and a variety of other ways, and then also just physically intervening to try to stop the fighting and themselves getting hurt or beaten in the process. And then also one area that I think about when I'm thinking about child exposure is the aftermath, what happens after the violence. And early on in my career, I was a school social worker, and there were a number of kids who stayed away from school, and we talked about school phobia. And in fact, I think a number of those kids were probably staying home to take care of a younger sibling or even take care of their mothers after she had been beaten and was unable to take care of them for a period of time. Aftermath includes the police coming into the home and either intervening and taking the perpetrator out of the home, arresting him and taking him to jail. Many times kids and their moms are put in the back of police cars and taken to a shelter. And many children see that as them being arrested, put in the back of the police car, and taken to a locked facility called a shelter. And sometimes they actually blame themselves for the violence as a result of that experience. So I think there are a variety of experiences, and I try to use children's experiencing domestic violence or children's exposure instead of the term witnessing. We know that children know a lot about what goes on in adult-to-adult domestic violence, and I'm mostly talking about men's abuse of women, of adult women who they're intimate partners with in this presentation. Certainly women abuse their adult male partners as well, but the overwhelming data in intimate partner violence, including sexual assault, murder, severe injuries shows that overwhelmingly it's male violence directed towards women, and that's probably a whole other topic of a presentation. But what we do know is that children know a lot about what goes on in domestic violence, and they often know more than their parents report that they know. So I cite here two studies, one by Johnson and colleagues in 2002 and one by O'Brien and colleagues in 94, where there were large discrepancies between what caregivers said children had been exposed to and what the children themselves reported. So I would stress one piece about this is that children report very differently, both what they've seen and the impact of what they've seen or experienced on them. And it's very important that we get information directly from children because they will report differently than their adult caregivers. We're very fortunate that just in the last month, David Finkelhorst, Sherry Hamby, and their colleagues have started to distribute pre-publication drafts of some of the results from the very first U.S. national survey on children exposed to domestic violence. They randomly surveyed 4,549 youth across the country, and they found a lot of exposure to family violence in general and domestic violence in particular. Over 1 in 4 children said that they had been exposed to at least one form of family violence during their childhood, 11% in the past year, so that's lifetime versus past year exposure. And when it comes to domestic violence, adult-to-adult domestic violence, 6.6% of the children reported in this brand new national survey, the first time we've had a survey like this, exposed to domestic violence, severe domestic violence in the past year. Other estimates by Bonnie Carlson, Renee McDonald, and her colleagues in Texas, Bonnie Carlson in New York, somewhere between 10 and 20% of children in the United States are exposed to domestic violence each year. That translates 7 to 15.5 million children. And then we also know that what the research shows is that children are frequently involved in domestic violence, that it affects their development, and that there is also a high co-occurrence of both domestic violence and physical or sexual abuse of children in the same home. So the next couple of slides will summarize each one. We'll take each one of these bullets and pull out some of the key findings, but it's really important to know that children are frequently involved in violent events. It affects their development, and there's also a high co-occurrence of child abuse and domestic violence. I'm hoping this moves. There it goes. We do have a number of studies over the last 20 years that children are in homes where there's domestic violence are 9 times more likely to intervene than are children in homes where there's no domestic violence, so intervene in parental conflicts. Even very young children, some of the early studies in the 80s showed that even very young children respond with negative emotions and try to interrupt parent conflict, and that children really show a variety of different kinds of responses. They get involved, physically involved, they try to distract their parents, they yell out to their parents, and they distance themselves. They hide under a bed, they close their door, they turn up the music, they put iPod on and blast the music, they leave the house, a lot of different ways to distance themselves as well. We have a number of studies, and I'm just breezing through this first piece because I think some of you know this and others don't, but we have a number of studies, probably over 100 now, but most of them don't separate out abused children from children who have been exposed or witnessed domestic violence. And I would say only about a third of them do that separation and really try to control for other kinds of victimization for children. But even those 1/3 of those studies, 30 or so, that are done well, do show that children exposed to domestic violence, when compared to other children, show greater behavioral and emotional problems, cognitive functioning problems, learning problems, and longer-term problems into young adulthood. And I'm not going to take the time here, but if you go to my center's website, which is on the bottom of the slide, there are a number of papers that I've published that are available online, and you can read more about the results of those studies. We also know, as I said before, that there's overlap between child abuse and neglect and domestic violence. Most studies found that from a third to two-thirds of families where children are exposed to domestic violence also have adult domestic violence going on. And the median, the halfway point in all these studies over about 20 years is 41% of the families. So if you're seeing families where there's domestic violence, there's also highly likely to be child physical abuse and neglect present, and vice versa. And this comes from a number of different studies, child fatality reviews, studies of abused children in child protection and children's hospital emergency rooms, and studies of battered mothers in shelters. We also are starting to have, for the first time, people looking at longitudinal data sets. These are generally smaller studies that have followed children, like the Yates et al. That's done here at the University of Minnesota, where they've, this was in 2003, they've now followed these same children for 30 years. Many of them are now parents, so they've followed them since they were born, and did find that preschool exposure to domestic violence did predict higher levels of externalized problems, that's aggression, acting out kinds of behavior problems among boys, and internalized problems, things like depression, anxiety, sleep disorders, and the like among girls in their adolescent and teen years. So early childhood exposure predicting later problems in later life in the Yates study. And then two other longitudinal studies, most of these not done to be focused on domestic violence, but are really adding a few questions as domestic violence has become a larger issue, adding some questions and then looking back at these children over time. Aaron Schaff's study of over 20 years of 543 children found, again, exposure to domestic violence in childhood, key predictor of both being a perpetrator as an adult and also being a victim survivor as an adult. And the same thing found in the very well-known California study, the ACE study, the Adverse Child Experiences study in Southern California that looked at 8,600 adults. And they're asking these adults retrospectively, so it's not following them from birth like the other two studies. But again, in the Aaron Schaff study, exposure to DV tripled the likelihood that you'd be a perpetrator or a victim as an adult. In the Whitehead and this is Folletti and colleagues study down in Southern California, they found that exposure to domestic violence in early childhood doubled the likelihood that you'd be either a perpetrator of domestic violence or a victim of domestic violence as an adult. So it's very important that we do a decent job of both screening and assessing domestic violence. It has both short-term and long-term impacts on children. And that experience is broad. It's not just the matter of a violent event and a child seeing it. The experience or the exposure is much broader than that. So what I'd like to do is move into screening for and assessing exposure to domestic violence. And the Family Violence Prevention Fund in 2004, which is based in San Francisco, and the PDF, the address is at the bottom of your screen. You can click on that to download the guidelines. But they published a set of consensus recommendations on screening for child exposure to domestic violence and child exposure to domestic violence in pediatric care settings. And I think even Linda was part of that group that developed those consensus findings. But one of the key recommendations is if you're doing screening, that you're screening abused caregivers without children present, because sometimes caregivers are trying to protect their children from exposure to more exposure to the violence and its results, and may not want to talk to you about it. And so one is to screen the caregivers without children present, but also when you're asking children, to ask them directly without caregivers. And I've posted here, these are direct quotes from the consensus guidelines of different suggested ways of proposing screening questions, both indirect and direct questions, and being sure that you are clear that if any child abuse is disclosed, that you probably are a mandated reporter. I would guess almost everybody online is, and that you may have to make a report to the child protection authorities if something like that is disclosed. So first, disclose your limits on confidentiality, both to caregivers and children, but then some of these indirect and direct questions I thought were very helpful, and I just highly recommend that you go to this consensus finding document online to find out more about it. And many of these don't say, are you being battered, or use terminology like that. It's really trying to stay concrete with children. Teens, like the direct question, teens see a lot of violence these days. Seeing parents or other adults fight can feel as bad as being hit yourself. Has this happened to you? I know I get screened every time I go into my doctor now. The nurse or the doctor screens, do you feel safe? Are you being hurt? Do you feel safe at home? And so there are a number of direct or somewhat indirect questions that are being asked regularly in many healthcare settings. So again, screening, I know a number of you are in healthcare settings. You don't have a lot of time with your patients, but to, one, disclose confidentiality limits, and then two, ask some indirect and direct questions, I think is a minimum, and to be careful about who is present when you do that asking, and then also be very careful about how you record that data, and I'm going to come back to that. Record the child's answers, where that information is going to go, and I'm going to come back to that in a few minutes later in the presentation. I've written a paper, and it's available online on the website that we'll go to in a few minutes, but I wrote an overview of what I thought were assessment issues in children's exposure to domestic violence. And certainly there's sort of the social history of the violence, the severity of the violence, how long it's gone on, how frequent it is currently, and then how long it's gone on, what is often called chronicity, how long it's gone on. But it's not just that history of violence that's important, but to think about to what degree a child is exposed to that violence. Different children in the same home can be exposed to different levels of violence. In fact, a study of 5 cities where police responded to domestic violence, young children 0 to 5 were much more likely to be present when the police arrived than older children. Older children have the opportunity to go to school, to leave the house, go to a friend's house, to play outside. Younger children are often in care at home, not going to school, and not playing on their own independent of being in the house with a caregiver. So it is likely that younger children are more likely to be exposed to domestic violence than older children, at least from this data when police arrive at the home. How the child's involved, I talked about that before briefly, but children can get involved physically, where they intervene and try to fight with the father. For 15 years, I facilitated batter intervention groups in a number of locations, and one of the exercises we did was recalling when you were first involved in violence in your own family, and many of the men answered that it was when they were 10 to 12 years old. They were now big enough and strong enough to oppose the adult male in the household who was being violent and intervene to try to protect their mothers. Many of them saying to themselves at the time that I would never do that to my wife or girlfriend, yet here they are 10 or 20 years later attending a batter intervention group. So how the child's getting involved, are they calling out, are they calling friends, are they calling 911? There are many different ways that children get involved in domestic violence, and trying to understand that involvement is very important. And what meaning the child gives to the violence. One thing that I don't have on here is, children do give meaning based on the relationship they have with the adult perpetrator. If it's a biological father who's been in their life, or a stepfather who has a long-term relationship with them, they're going to give it a much greater meaning and be in much, I think, greater turmoil about the violence and their loyalties between the perpetrator and the victim survivor and the family than if this is a temporary boyfriend who comes in and out of the house quickly and in and out of their life quickly. I think we also have to look at how a child copes or does not cope with stress and violence. What are their positive coping skills? What are those things that they're doing, even if it's running to their room and hiding under a bed and putting an iPod in their ears? That can be actually a fairly good way for a child to cope and try to remove themselves from the violent situation. Other kids want to be part of it and try to do something actively to engage and engage helpers like neighbors, family members, best friends, parents are often brought in, teachers contacted, or calling 911. So there are a lot of different ways that children cope with the violence and respond to it, and I think we need to assess that pretty carefully. Another very important issue is what are the protective and risk factors in the child's life. Protective and risk factors are often usually the flip side of each other. So the absence of something could be a protective factor. The absence of substance abuse among caregivers is protective. If it's present, it's a risk factor. So sometimes they're sort of the flip side of the same thing. But I even think of the physical environment in which children live. If they're in a rural setting or if they're in an urban setting, if they have neighbors nearby, represent different levels of risk or protection for them in their lives. How protective their battered mother is for them. Many battered mothers are very protective to their children despite being victims of domestic violence. And I think we have to carefully assess what are the protective and risk factors of both parents. I have that as the last bullet on this slide. And what is the impact of this exposure on children? And one thing we do know from the research is that the impact varies greatly depending on all these other factors that are listed on this slide. Some children are impacted as much as, and sometimes even more than, when they are physically abused by being exposed to adult domestic violence. Some children have enough protective other factors in their lives, both as protective mothers, protective other adults, siblings who take care of them, teachers, that they can be exposed to domestic violence. It's not good for them. It's a terrible, traumatic experience for them, but they can survive through that and come out as fairly healthy teenagers and adults. They may be at greater risk, but not all children come out being perpetrators or victims of domestic violence. And I should put that caveat there that the child abuse research shows that only about a third of children who are abused become abusive parents as an adult. And while we don't have that exact data for child exposure, we do know that it puts you at higher risk, double or triple in those longitudinal studies, for being a perpetrator or a victim in adulthood. But while that puts you at greater risk, probably the majority of children who have been exposed to domestic violence come out of that and do not perpetrate or are not victims of domestic violence in their adult lives. And we need to keep that in our minds as we're looking at the strengths in their lives, the assets, the protective factors that exist. I reviewed a number of existing measures in that article, the same article that I'm referencing, and the problem with most of these measures that are listed here, and I'm going to run through a couple of them very quickly, is that they were not designed to measure children's exposure to domestic violence in the home. Many of them include one or two questions about exposure to home-based violence, but are focused more on community, school violence, video violence, and the like, and then only include 1 to 4 questions on children's exposure. Some have taken Murray Strauss's and Richard Gellis's conflict tactics scale, the CTS, and changed it to be how much has your child been exposed, but that measure was not designed to measure children's exposure in the first place. This is an example, and you can't read it on here because it's a little blurry, but it's of the third one down, the VEX-R by Fox and Levitt. It was developed in Israel, the violence exposure measure. And this one, it's for young children. It's a drawing, and the boy's name is Nitzan, which is a Hebrew name. Nitzan is at school. Nitzan sees a boy chase another boy at school. And then the child says never the empty thermometer up to many times, the full thermometer. And it goes through a whole series of questions like this, and there are a few on family violence. This one's on television violence. Well, it's not violence, but it's chasing. And there are some direct ones about violence going on both in community, on television, in the home. And again, the young child sees the picture, they read the question, and then they answer on this thermometer from never to many times. David Finkelhor earlier developed the juvenile violence questionnaire. There are a number of questions on children's exposure to different kinds of violence that I've put up on the screen here. The witness to domestic violence, so in the last year, did you see one of your parents get hit by another parent or their boyfriend or girlfriend? How about slapped, punched, or beat up? And but there are only very few questions in this juvenile violence questionnaire about domestic violence. They ask how many times were you hurt, if so, how, but it doesn't ask who did this to you, which is a major problem in this measure. What we found is that there really is a gap in current measures on children's exposure to domestic violence. Few focus on exposure directly. Few collect this kind of information that I was talking about earlier. Very few use child direct self-report rather than most of them ask the adult, and we know from other research that children, again, report very differently than their adult caregivers report. And again, very few of these are for very young children, 0 to 5. So I want to move a little bit, and then I'm going to open it up to questions in a second, but I wanted to move. There are a number of people around North America who have done some great work on structured interviews for assessing children's exposure to domestic violence. Peter Jaffe and his colleagues at the Center for Children, Families and the Court in London, Ontario, and they have a tremendous amount of material available online that I highly recommend to you. Betsy McAllister Groves and colleagues at Boston Medical Center, and then in California at Alicia Lieberman and Patricia Van Horn at the San Francisco General Hospital. All of them have written about their work. They all have good protocols that they've developed for assessing child exposure to domestic violence. And I'd highly recommend looking at their work for some of what they say about structured interviews. Another technique is drawing pictures, getting children to draw pictures, especially young children it's very useful for. And then I am going to talk about the CEDV that we've developed, the Child Exposure to Domestic Violence Scale. So keep in mind, I know a lot of you are in hospital and healthcare settings, that you really need a confidential space. You need child-friendly spaces, place that's out of hearing range of parents. Again, going back to those consensus guidelines from the Family Violence Prevention Fund, that you should be interviewing children separate from their caregivers and removed from, obviously, from the context of violence, that there's a safe environment, that they feel it's a safe place to be answering questions. And this comes from Betsy McAllister Groves, again, in Boston, and some of her colleagues. But again, describing your role, again, very important to disclose confidentiality and acknowledge your power in the situation, what you can or cannot do as a result of information you're getting. And recognize that many children may feel loyalty to the abusive parent and that they may be trying to protect them through the interview that you're doing. I think you also need, as Betsy writes, that to respect children's right not to talk and to allow them time. It may not be this interview, it may be other interviews, and forcing them to talk may, from their own experience, if they're coerced, it may get them to shut down. And again, Betsy's recommendation, don't make promises you can't keep, and that's especially important for children's trust of you. A number of people have written about using free drawing and storytelling. So can you draw a picture that you can tell me a story about? And I know Inat Pellet and Diane Davis, who've worked here in Minnesota with me in their children's programming, they one of the children drew a picture of Dad in the house, and asked to talk about that because Dad wasn't living at home. The child was saying, well, I want Dad in the house, but Mom doesn't want him in the house. And so just getting a picture like that where it shows the house with and where the perpetrator is located, either out or inside the house, can tell you a lot about some of the tensions and some of the ways in which children may feel differently than their mothers about the perpetrator of the violence. So we've used that in children's groups in a number of settings to help children, especially younger children, talk about the violence. Here's an example of free drawing storytelling. And he constructed a picture of a home. This is another one where the home is drawn, large square covering most of the space, family members, small figures standing either side of the large house, boy and his mother on one side, younger brother and father on the other side. So here they're on either sides of the house, and the child was clearly from this picture and in the discussion of the picture with the therapist aligning himself with the mother, and saw his sibling, his brother, aligning himself with the father. And child was asked what would happen when if everybody went into the house, and the boy talked about how the fighting would start, and it was a way for him to start talking about the fighting and telling a story of the violence that went on in the home. And that's just one example, but certainly with young children, drawing is very important. I mentioned this before, the types of violence, the severity, the frequency, and I should have a fourth bullet here, the chronicity, how long it's gone on, really important. The way in which the children are exposed, are they nearby, are they involved, are they seeing it, are they hearing it, are they far away, are they seeing the aftermath, very important. How they're getting involved, are they calling the police, are they doing other kinds of active intervention, or are they doing other kinds of passive coping? So some people have called this sort of active coping, passive coping. Active coping being doing something, passive coping being just sort of withdrawing and closing themselves off, maybe putting on an iPod or something like that. Really important that we interview children about their coping strategies, what they are doing. Are they hiding? Are they keeping themselves safe? Do they have a safety plan? And those active and passive strategies of how they cope with violence that's going on in their home is a very important aspect of assessment. And equal to that, I think, is how children have succeeded in keeping themselves safe through this violence, and where they find support, where they find protective factors, who they're talking to, where they're feeling safe. Is it at school? Many adults who have survived domestic violence in their homes as children talk about teachers who have taken them under their wings and help support them and help give them a positive experience in school. So I think it's very important that we not only assess coping and the history of violence that's gone in the home, but also what are the strengths in the child's environment and their life. And then trying to end the interview on a positive note and being sure that you talk to the child about what will happen next, what will happen with the information they've given you, and again, coming back to the earlier slide, don't make promises you can't keep. One thing I mentioned earlier, and I can't stress this too much, and I put a couple slides in here, is protecting information. One of the fears I've had is as we become more concerned about children's exposure and we directly ask children for information, that information potentially could get into the hands of perpetrators. And I have actually seen police reports that then the perpetrator and his attorney get a hold of. And there have been some dire consequences for children for making those disclosures, and then it boomeranging back, and the perpetrator, the violent male in the home, getting a hold of that and blaming the child for whatever is happening to him with the police and others, particularly 911 calls and things like that. So for me, protecting how you can protect information is really important. I participated in a project sponsored by the National Council of Juvenile and Family Court Judges in Reno, Nevada. That's where they're located. And it's called the Green Book, and you have a website at the bottom of the slide that you can click. I believe that's an active link, that you can click on and go to that website. But one of the key issues, and this was about child protection, working with domestic violence, and working with courts, so those three institutions working together. And it was really a tough piece about sharing information, because one concern that many of the battered women's advocates had was that information that the women have disclosed or the children have disclosed will get into the hands of the male abuser. So whatever you do when you're thinking about collecting this information, you have to have, you need to only collect the information that you absolutely need, if it's maltreatment information or if it's exposure information. And you have to have some kind of policy for keeping that information safe. So generally thinking about what's the minimum amount of information that you need to share or record to be providing ethical and competent service, but to also be able to protect disclosure of location is a really important one, of telephone numbers, contact information, where moms will be, like if they're coming in for an appointment, not disclosing that to their perpetrator, and being very careful about where you share that information, where it goes, and who has access to it. Again, these are all about being very careful about what you record. So if you have to think about how you learned about the facts that you're sharing and who disclosed them, and be very careful about the kinds of issues like safety plans. You know, if a woman or a child has a safety plan that you've worked on, has contacts to relatives, friends, and others, that not be disclosed, current addresses, current phone numbers, and the like. And I'd say even I'd go beyond that, because I would say that it's really also about what the child is reporting about the perpetrator, that if that gets back to him, it can have dire consequences for that child. So to be very careful about that. So those are my slides about safety of information, I guess I would call it. And then I wanted to just briefly talk about how we developed the child exposure to domestic violence scale, what it is, and where you can access it. We developed the child exposure to domestic violence scale from trying to collect from all these different measures we had reviewed. We added new items as well. We assembled a panel of international judges from Canada, the United States, and Israel, who went online and reviewed each item, suggested additions, deletions, and we revised the measure based on this judge's review, and then pilot tested it with 10 children, and then again revised it into what it is pretty much now, which is self-administered. Again, we want to get information directly from children, so we limited the age group that we were working with to 10 to 16-year-olds who could answer on a paper pencil measure a series of questions. We have 33 questions, and they list a variety of different things that I've gone through already in our discussion today, but we ask specific questions about these different areas that are bulleted here. Here are some of the questions. We have 10 items on violence. So how often has your mom's partner hurt or tried to hurt a pet in your home on purpose? And we do know from the American Humane Association that there's a high correlation between the abuse of pets in a home and child and adult domestic violence, child abuse and adult domestic violence in the same homes. How often has your mom's partner ruined, broken, or destroyed something on purpose, like punching a wall, ripping a phone cord out of the wall, smashing a picture, things like that? So that's an indirect form of violence. It's violence, but it's not directly hurting somebody else, but it's a very threatening form of violence. So we have 10 different questions that vary in the types of violence that we're asking about. And then they answer that question, never, sometimes, or a lot. And then if they answer sometimes to a lot, we ask them to check one of the boxes below. I saw the outcome. I heard about it afterwards. I heard it while it was happening. I saw it from far away. I saw it and was near while it was happening. So different ways of being exposed to that domestic violence. We also have 7 items that we ask about how they involve themselves in the violence. So how often have you gotten physically involved in trying to stop the fighting? Have you tried to get away from the fighting by hiding, leaving the house, etc.? So we have 7 involvement questions like that. And then we have other risks and other exposures. Moms and male partners' use of drugs or alcohol, mom's sort of depression, sad, worried, upset. We tried to gear this to 4th grade reading level, so we did a readability test on it, and we changed a number of words to bring it down to 4th grade. And how often have you dealt with big changes in your life? And because there's a whole body of research on frequent life changes and its impact on children and adults, and so we ask a question about that. How often have you seen someone being hurt or killed in a video game? I think we had 95% saying yes to that, so it doesn't really differentiate children. It's almost universal among children. Same with somebody being hurt or killed on television. And how often has somebody in your home touched your private parts when you didn't want them to, so a sexual abuse question. There's also a child abuse question in there as well. So in our initial study, we administered it. We ended up with 65 children. We gave them a Target is headquartered here in Minneapolis, so we're big on Target gift cards. So we gave them each a $25 gift card for completing 2 weeks. They filled it out 1 week, filled it out the next week as well. And each program that participated, we reimbursed as well. We did a test-retest 1 week apart, which is a reliability test. We looked at content and face validity, convergent validity. And we can say that after looking at all that, it did come out as a fairly reliable and valid measure. And we've published an article, which is cited down here at the bottom of the slide, that discloses all that information in detail. We did revise based on that first test with the 65 children. We added a often part of the scale, so now the thermometer, much like that VEX-R measure, we have this thermometer that we use, goes across 4 different measures, 4 different responses instead of 3 in the original. We did change some of the wording as well. We simplified the wording further and added that 4-point scaling. So the final measure, which is available on a website, and the website is here on this slide, it's available free. We have the measure in a PDF that you can download for free. We have a 55-page handbook that's free for you to download, and a number of articles that I've mentioned here on both assessment of child exposure and on the scale itself that are all up online, free for you to download and use. Last year, during 2008, we had 10,000 downloads of the handbook alone. And we know it's being used in Canada, in Chicago public schools, in Sweden, and a number of different places. This is just a picture of the website and the website link. This is an active link on screen right now if you want to look at it or look at it later. And then these are just places you can go where you can get a lot more information about what I've talked about today. I'd highly recommend the top one, the CEDV scale, and some of the articles that are available on that website.
We'd like to get your feedback so that we can continue to improve our trainings. Please take a moment to fill out the evaluation by clicking the image on this slide, or by going to surveymonkey.com/s/learning area. Thank you for joining us. For additional information and resources, please visit our website at familiesthrive.org. If you'd like additional training or support, please call us at 925-313-1791 or email info@familiesthrive.org.